Hello, my name is Isabel Zhu. I am a first-year graduate student at the University of Oregon. I am applying for an externship in speech-language pathology at Kaiser Permanente. At the University of Oregon's Speech, Language, and Hearing Center, I worked with adult clients at both the Fluency Clinic and the Brain Injury and Concussion Clinic. At both of these clinic rotations, I practiced skills relevant to working with adult clients, such as interpreting standardized cognitive assessments and implementing individualized treatment plans addressing motor speech and cognitive impairments. While working with adult clients, I learned to incorporate counseling and caregiver training in my therapy sessions, as they both are vitally significant in our clients' journey of recovery. There are several aspects I love about the field of speech pathology. Firstly, it provides many career options. No matter which career option I end up with, I know it will still provide me the opportunity to help clients who have swallowing or communication or cognitive deficits. While I initially wanted to work in an outpatient setting, I now have a strong desire to work in an acute setting because of my increasing interests in dysphagia assessment and management. I also enjoy the option of becoming specialized in certain areas of the field through practices and continuous learning opportunities provided by ASHA and many other organizations. Additionally, I really like the fact how a speech pathologist can empower clients and their family members and at the same time be humbled and inspired by them as well. I absolutely feel privileged and inspired by my clients at the UFO clinics because every time I walk into the room, they teach me something new. And I feel very privileged to work with them and be able to provide support along the way. As a first-year graduate student, my exposure to a wide variety of diagnoses and disorders in this profession may be limited. While working with clients who have less common conditions, I might not feel as confident in my treatment planning. But with further exposure, clinic training, and schooling, I am very confident that I will become knowledgeable in those less common conditions and be able to search for the best evidence-based intervention approaches for my clients while remaining flexible for modification as needed. Throughout my clinic rotations here at the U of O, I have acquired experiences working with clients who have various diagnoses or those who come from culturally and linguistically diverse backgrounds, and also those who come from different socioeconomic status. I understand that there will be clients with diagnoses or cultural backgrounds that I'm less familiar with. So I approach every client with an open mind and readiness to listen to their stories. I do not have any types of patients that I do not feel comfortable working with. I enjoy the hands-on learning process with feedback from my supervisors, especially specific feedback pertaining to various aspects of my clinical practice so that I can reflect and see how I can improve in specific contexts. Additionally, I do not mind receiving constructive criticism because I see them as helpful tools for me to acquire new learning. As a student clinician here at the UFO clinics, I was given a lot of independence and feedback at the same time, which I believe led to my quickly established confidence and increasing comfort during my real-time sessions with clients. Overall, I am very organized and I make sure to be prepared for my therapy sessions. But for the acute care setting, I understand that it's not always possible to have all the time you need for preparation. Additionally, surprises during session time will come up regardless what setting that you're in. So all these uncertainties and heavy workload indeed can be quite stressful. But I have learned to be flexible and also remain calm and develop my personal strategies to combat those situations. For the heavy workload, I have my strategies in prioritization and time management. And for unexpected situations during real session time, I have learned to be flexible and remain calm to modify and evaluate the situation and follow my client's lead to encourage their buy-in. I will review documents available to see what needs to be assessed, and the assessment results will tell me whether further testing will be needed. I will familiarize myself with the assessment protocol prior to its administration. Besides the assessment protocol, I will also have questions in place for my clients and their caregivers to help me better understand their struggles and strengths in a functional context, and to also encourage this therapeutic alliance between me, the therapist, and my clients and their families to encourage greater collaboration during session time. I also have learned here at the U of O clinics that I will need to allow modifications in place during session time that are tailored to individual needs. For example, I will have more complicated tasks in place during a session for my clients who are performing very well, showing great progress in structured activities to encourage greater progress and motivation. Whereas for a client that is showing minimum progress, I will have a step down activity to help alleviate some of the frustrations. I would describe myself as a curious, hardworking, determined, and adaptable person. My clients describe me as someone who is supportive, patient, and positive. In my clinical evaluations, my supervisors consistently noted my strengths in critical thinking, problem solving, rapport building, flexibility, and independence. The major belief underpinning all my clinical work is to work compassionately alongside my clients to capitalize on their unique strengths, address each of their needs, and assist them in attaining their goals. As an SLP, I believe it's very important that we work with our clients, collaborate with them, and we work as a team in addressing their needs and work together toward their treatment goals. I hope to become a speech language pathologist in an acute care hospital setting to work with adult clients in 5 years. Although I remain an open mind to other clinical experiences, I feel confident that my interest in working with adults will grow as I continue to learn and obtain experiences from other clinical rotations here at the U of O throughout the remainder of my graduate program.